there's this additional sort of worry that's kicking in, like, how can I function this way moving forward? I think by the time they usually get to our offices, they know that something has to change.
We can have anxiety about addressing our anxiety, right?
Yeah.
Like it
Yeah.
can be scary to go meet with someone to talk about something that you would rather avoid. You would rather hope that it's going to get better on its own.
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
Good morning, Andrew.
Good morning, Dave. Here we are, another episode of Taking Good Care. We're back.
And we're recording kind of at the end of April, and the snow is flying here in Edmonton. So, oh man, yeah, it's been a winter. So
We had baseball practice yesterday outdoors. It was like 18 degrees, sunny, families outside. It was nice.
so jealous. I can't wait. I can't wait.
Oh, well, here we are today, and we're going to talk about anxiety.
Yeah, it's almost wild that we haven't. I mean, we've touched on it here and there. You can't talk about mental health without talking about anxiety, but
Yeah.
it is, arguably the most common mental health concern, right? And we're going to devote some specific time just to talk about anxiety diagnoses, anxiety treatment, what anxiety might look like in our office when we're meeting with people. Yeah.
You're right. It's pretty wild that we haven't done an anxiety episode after 53 episodes, I want to say, because it is such a common referral question. And it's like everybody, including kids who I see, they can define what anxiety is. That's how aware I think nowadays society is of anxiety. But having said that, I do think that there's still a lot of psychoeducation that can be used and disseminated in terms of understanding, for me, what clinical anxiety is. What makes it debilitating? At what point does it become debilitating? Because I think the word is thrown out there a lot. And whether it's accurate or inaccurate, that's sort of a question that often comes up.
For sure. And I think, the mission of this podcast is to, help people kind of sort out what kind of care might they need. And, like you were saying, it's almost like, when do I go talk to someone about my anxiety? Or like, when do I might need more help than a self-help book or just talking with friends and family? That is kind of a decision point that a lot of people struggle with, that hopefully we can demystify a little bit and give some direction so that you can, again, take care of yourself better and take care of the people around you better. So this information might be able to help with that.
Yep. And I also find, along with depression, anxiety is one of those conditions where so many people have struggled for a long time and they've tried to push through. They've tried to, like you said, the self-help books. They've tried to talk to friends about certain things, but there gets to a point when they've tried to do things on their own and it just hasn't helped.
Well, and anxiety is we talk about hardwired parts of us, right? Like anxiety has kept our species alive and keeps other species alive. Like we would not survive without anxiety. So in some ways it's a gift and it's beneficial. And in other ways, especially for humans with the big brain or the big prefrontal cortex, where we can worry about all kinds of things that may never happen. And that's where I think people get stuck, right? Just being afraid of something that's going to hurt us is natural and normal. When we can't sleep, when we can't eat, when we are, not able to think clearly about other things, that it's intrusive, and it's affecting our functioning, affecting our ability to live our life. And I think actually one of the ways that I explain anxiety sometimes is that it like the the more anxiety we have, the more our world kind of closes down on us, and we're less able to do the things that we really love doing and that makes life kind of meaningful. And so you get to a point where you're just possibly paralyzed by the anxiety and not leaving your house.
Do you ever talk to your clients about the difference between anxiety, stress, and nervousness? Because I've always found that maybe more so with the kids and teens, I would say adults too, that I need to talk about those differences, or else everything gets clumped into this word anxiety.
Yeah, you know what? I'm curious to hear how you explain it and how you talk
Hmm.
about it, because I find I actually might do the opposite. I might actually clump it all together and like just kind of look at like the nervous system and our parasympathetic and our sympathetic responses and what happens in our body when we're worried about something or anticipating something dangerous or under threat, and even the fight, flight, or freeze response. And so I think we can go both ways. It can be helpful to kind of like maybe just distill it down and lump it all as like worry, and then also break it down into types of worry or types of
Mm.
reactions in the body, like you're talking about.
Well, I guess I break it down into stress and nervousness. And I sort of see that as a little bit different from, let's say, and we'll talk about this later on, those clinical symptoms of anxiety, because I do let people know that, hey, if you've got a music recital, if you have a performance, or you have an exam or a test, that will provoke stress, that will prompt nervousness. And this is why, like, you will study, you will spend time to organize your time to go and study. It sort of gets us up and practicing for that music recital that you have to do. And so that moment of stress, maybe it's like a week long intense stress that you have leading up to a certain event. This is why we have that. So we prepare and then we go out there, we perform to the best of our ability. And then a lot of the time when I talk to my students, it's like after the exam, after the big test, how do you feel? It's like, ah, right. It's like that sigh of relief,
Mm-hmm.
right? It's like, that's right. So you've performed now, and now you feel that release. And it's like that moment of stress, that week of stress is now done. That worry that you had or that nervousness that you had is now done. Whereas I see anxiety as a little bit different from that. But I know you want to say something, so I'll let you go.
No, no, I want to hear how it's different. Yeah.
So for me, when I work with clients with anxiety, so I'll start off with some psychoeducation around that, right? But then I will also then go into talking about, okay, this is when you experience anxiety more so in a chronic state. And it's not so much now situational, but there's more chronicity to it. It's repeated over and over again. It's prolonged. And the coping strategies that we may use, for example, if you're worried about a music recital, if you're worried about a performance, you prepare, and oftentimes as you prepare, you're getting better at it. That worry will tend to just come down as you keep practicing because you're like, okay, I'm getting it. I'm getting to the place where I want to be and I'm ready. Whereas with anxiety, going to work, going to school, worrying about what's happening with your parents during the day, there is there's a level of perhaps irrationality to it, but also anything that we're trying to manage that anxiety, it's very challenging still, right? And it's just over a longer period of time that we're trying to manage that anxiety. It's not working.
Well, I'm listening to you and I'm thinking now you're describing generalized anxiety disorder,
Right.
right?
Right.
So you're really differentiating between, an acute anxiety that has a specific trigger or a specific kind of stimulus that is creating a sense of threat or
Yeah.
worry or concern. And then if you address that, then the anxiety goes away, or the feeling of that. Like anxiety essentially is this uncomfortable negative emotion that we try to do something to get rid of. Like that
Hmm.
is kind of how it motivates us to
Hmm.
study more or to avoid things that are dangerous, right? If it felt good, we would go towards it or we would not study, right? Like, so it's an aversive stimulus. And so that's how I kind of break it back down to like general, that we have these experiences all the time. At what point does it become a clinical diagnosis? Like that's where I'm listening to you kind of, and the definition of, and I think we could talk back and forth for a while, but okay, let's hold off on going through the specific kind of different diagnoses. And I don't think we need to spend a ton of time on it, but it is something that I think is useful for people to kind of get a sense of. So before doing that, I think going back to what you were saying about studying, the example of studying for an exam, and then when the exam is over, you feel relief or you feel like the anxiety dissipates. That
Yeah.
is like a rewarding sensation, right?
Hmm.
So you think about like our species evolving and how anxiety has kind of like done that for us in so many ways.
Hmm.
But where it becomes a problem, right? If we start avoiding all the things that stress us and like or finishing something really fast so we don't feel the anxiety, right? We complete the task, but we don't do it very well. Like exposure therapy is one of the ways that we can challenge anxiety. We can expose ourselves to the thing that creates a fear response and know
Hmm.
that it does not hurt us, right? So, how much do we study for an exam, right? How much do we start worrying about the exam that's coming up in 6 months?
Yep.
Right.
Yep.
These are the things where we start to look at like, okay, anxiety is normal, but it also can become problematic.
Yes. Oh, so many questions as you were talking there, right? For me, it's how debilitating is it?
Yeah.
When does it get to the point where you can no longer perform in a way that helps you get through that stressful, worrisome situation? It's not to say you have to perform perfectly through it. It's not to say that you're not going to come out unscathed at all, but at least to be able to problem solve, regulate, and get through a particular situation. And I think for as a clinician, when it gets really debilitating, right? We're now getting to the level of avoidance, right? We're not going to school. We can't even get through the doors of the school, or we can't let go of our parents. We can't get out of bed for work. Those are pretty extreme examples.
Hmm.
And it's not your, daily examples, but for me, that is debilitating.
Yeah. And I mean, and again, we're going to hold off from going through some of the diagnoses, but, having a panic attack, having an acute anxiety attack
Yeah.
that, like you said, debilitating, like people go to the ER
Yeah.
because they are fearing or they are feeling like they are dying in that
Yeah.
moment. And
Yeah.
I've even worked with people that like you said, it affects their career, it affects their ability to do things with their kids, right? Having one panic attack can trigger this sense of anxiety that is really debilitating. Even if you're not having another panic attack, the fear of having another panic attack in a public
Yes.
place can be debilitating.
Yeah, I've had clients who will have to pull to the side of the road because as they're driving, this sudden panic attack just comes and they can't function, they can't drive, right? Or clients who cannot get into a vehicle after having been in an accident and now they can't leave their home, they can't go places because they're so fearful of commuting. So,
Hmm.
yeah.
Yeah, just I mean, again, this is like a really horrible experience when it's acute, when it's really strong. On a lower level, that's that kind of generalized anxiety where it just can create like stomach problems.
Hmm.
Like you can be referred to as like a worrier or like there's different terms that people will say, oh, that person is like this, they're always stressed about everything, they're always worrying about everything. I'm sure you can think of someone in your life or maybe yourself that has got that kind of label. So yeah, it varies in terms of intensity and then kind of like how it's felt and how it affects physically, mentally, emotionally.
The other piece that I wanted to touch on too before we go any further is that anxiety can also be a whole host of other emotions. And I've seen this working with children up to adults. Again, everything gets clumped into anxiety. And maybe that's why I'm a little bit averse to clumping everything into anxiety. Because
Mhm.
when I've worked with some clients in the past, and I will always remember this one particular client, everything was anxiety. Getting together with people, very, very challenging. And it wasn't until we started to expose other emotions, such as sadness and fear and anger,
Mhm.
did we then actually sort of break down this whole idea of anxiety. Like it was funny, like once we started to talk about all these other emotions, anxiety in and of itself started to melt away. But like that's why I think just through my clinical experience, I try to break it down because if I clump everything into anxiety,
Mhm.
it it makes it a barrier to opening the door to all these other emotions that can be exacerbating this idea or this feeling of anxiety. Does that make sense?
It does. I mean, I feel like I'll clump it all together and then I'll start to
Yeah.
look at like what is triggering or what is the stimulus or what is and it's not always clear and direct. Like especially even with panic attacks, they feel like they come out of the blue,
Yeah.
right? And so it does take some let's kind of like at least from my approach, I tend to go with like let's feel it, let's notice what it feels like from a real
Yes.
mindfulness approach, and then notice what else like kind of comes up, any
Yep.
thoughts, any right, and then we start to someone could have anxiety because they don't want to feel another feeling, right? That
Yep.
they could be sad and not want to feel sad, and then it shows up as anxiety. We can have feelings about our feelings, right? So that's
Yep.
when I hear you talk, and I'm like, of course, you would want to know what other feelings are there, and then sometimes we can name it to tame it, and we don't have that same anxiety anymore. It's we're able to talk about what's bothering us.
Yep. We name it to tame it. So I completely agree. Like in terms of having the person be comfortable feeling that anxiety in the session, to know that it's a safe space
Hmm.
before moving forward to working on the other things to again tame the anxiety. Right.
Well, avoiding the anxiety becomes a
Yes.
problem, right? So
Yes.
yeah, I mean, there's actually some I like this. There's some research on looking at like the physical feelings. Like we're always interpreting what's happening in our body to some degree.
Mhm.
They call it interoception, right?
Yeah.
So our heart rate, our stomach, our internal organs, like to some degree, we are feeling what's going on the inside. So some of the things that can trigger anxiety is just a high heart rate. Your heart starts beating out of your chest, and you're like, I don't know what's going on. I'm not exercising right now. Like there must be something bad going to happen. And then that spiral starts to happen. And
Yeah.
so some of the exposure therapy, some of the treatment is like actually get your heart rate up there, actually induce some of these uncomfortable physical feelings
Yeah.
and notice that you're like, okay. Right.
Yes.
Yeah.
Yes.
And that's a
Yeah.
lot of what therapy can be. It's like go to places where you think you won't come back from or you won't be okay with a person that is like kind of helping you and you learn that it's like I can manage these. I can feel these feelings and still be okay.
Well, that's why I always go back to therapeutic rapport, right? You might be a very anxious individual, but it's our job as a therapist, as a psychologist, to help you feel as comfortable as you can with us in a session so that you feel safe to feel anxiety or whatever other emotion you're having without
Mhm.
thinking that I need to run out of this office. Right?
Yeah. Oh,
Yeah, go
go
for
go ahead. Go ahead.
it. Well, I think just supervising so many individuals, we're in this helping profession where we want to see results, right? We want to know how can I help this person? How can I quote unquote fix this? But again, I always go back and I always say, how many times have you seen this individual? And they'd be like, maybe once or twice, right? We it's so hard to even start the quote unquote work, the actual work, until you have the strongest bond with this individual. Part of finding that bond and that therapeutic relationship is the work,
Yeah.
right? And we just have to help them feel as comfortable as possible so that they can approach what they often avoided.
Okay, but you're essentially helping the therapist or the clinician with their own anxiety, right?
That's right.
Like,
That's right.
yeah. So
That's right.
they might have a thought that I need to help this person and I need to see improvement in 2 sessions. And you're like, hold on, right?
Yep.
And so actually there's a lot of debate about this even in our like in our training, right? In terms of making sure supervision doesn't turn into therapy. But it's hard, right? Because yeah, like if we as therapists have anxiety, it's going to be hard for us to help someone with their anxiety. Like there's an overlap there that like we are the instrument that we're using to help people. So you
But
know,
who are you ultimately benefiting?
well, yeah, yeah, but in terms of like, what if someone's like, what if one of these trainees or like supervisees all of a sudden they're like, oh yeah, I do have some anxiety about helping people, and it's because of this experience that happened when I was 5, right? And then you're like, oh, like, do we reprocess that experience, or do we say, you know what, getting some therapy for yourself, right? And then also like from a supervisor perspective, like how do I help you to be able to help your clients? Just keep the focus on like the work that you're doing with the clients, but just you might stumble across some of these things, right? We all have our own trauma. We all have our own
Sure.
background.
So I guess in short, I would say no, we do not reprocess whatever happened at 5 years old.
Yeah, sure. Yeah.
But we
Yeah.
could make the suggestion, hey, maybe it'll be good to seek out some of your own work,
Yeah.
right? But for me, it's that line is like, okay, who are we ultimately benefiting here? And how do we stay on track in terms of the profession
Mhm.
versus your personal stuff, right?
Yeah. Yeah. And I didn't want to like spend a ton of time on this, but it actually brought something up for me. So I'll self-disclose it. For a while, especially initially, like I didn't work very well with anxiety, right? For kind of the like some of the reasons that you're talking about. But and then we've talked about this in other episodes, but this co-regulation, the way that like
Mm,
anxiety can be contagious, right?
yes.
And I would literally feel the anxiety of someone who was experiencing a lot of anxiety, and it would
Yeah.
trigger my own anxiety. And I wasn't in a very good position to be like supporting someone. I would, I'd be like trying to teach them things or not really connecting with them, like you said,
Yeah.
that relationship piece.
Yeah.
I would be kind of trying to fix the anxiety. And once I started to recognize that and manage my own anxiety that would come up, then I was in a better position to be able to sit with someone in that uncomfortable feeling.
Yeah.
And and that co-regulation piece goes both ways. So if I'm really regulated and calm and I kind of feel like I can handle this, the other person is also going to, their anxiety is going to come down.
Yeah. It's true. It's true. When I get somebody in a session who is presenting with a lot of anxiety, my spidey senses go off, and I always remind myself, okay, you have to, as a clinician, I have to bring down that energy level, that anxiety level, all the way down in myself, right? So the higher somebody is, the lower I need to go.
Mm-hmm.
To your point about the co-regulation.
Mm-hmm. Yeah. So you're doing self regulation to be able to co-regulate. And even like we do this with kids, right?
Yeah.
If a kid is freaking out, if we freak out,
Mm-hmm.
right? And it happens really quickly, right?
Mm-hmm.
My son yesterday, we grabbed like Subway to eat in between the like spring concert that was happening at school, and he was trying to look at a book and eat his Subway. We're not advertising Subway, so I don't know if I should. We're eating a
Sandwich
sandwich.
shop.
Yeah, sandwich shop. But he drops his sub, right? And the stuff fall out of it. We're in the vehicle. It is a huge, like he is very upset very quickly. And what do? I turn around and I want to say, like, put the book away, right? Like the reason this happened is because, and I start wanting to like teach and explain and make sure this doesn't happen again. And my wife looks at me and she's like, don't. And I'm like, oh, yeah, probably not going to be helpful right now, right? It's going to increase his nervous system and his arousal because I'm already ramped up. So I got to take a breath while my wife talked to him about like, oh, that's terrible. Like that, it sucks when your sub falls and you like can't eat it anymore, right? Like I get you're upset. And I was like, oh, that's what I wanted to say, after I took a couple breaths.
Yeah.
So I think that
Yeah.
this anxiety can move really quickly. It can be like a snapping of the fingers, especially if a client gets triggered in your office, because we don't want to feel it. We don't want other people to feel it. And we can all of a sudden be like colluding in this, like, get rid of it as fast as possible.
Mm-hmm. Mm-hmm. So what does anxiety feel like? Physical symptoms.
Well, we kind of started. I don't know. I feel like I've been talking a lot. Maybe you jump in and tell me
All
what
right.
anxiety
All
feels.
right. All right. So this is one of those things, I guess, from a diagnostic perspective, and when we're trying to figure out body cues, we always try to figure out, okay, what does the anxiety feel like for the individual? Right. And so a lot of physical symptoms are associated with anxiety, and usually there's more than one. So we can talk about headaches, migraines, difficulty breathing, like a heavy, heavy sense when you're trying to breathe, rapid heart rate, sweating, the jitters, restless legs, oh my goodness, stomach aches, difficulty with bowel or bladder control. What else? Dry mouth.
Yeah.
Right? All sorts of different physical symptoms. Do you have any more? Can you think of any
Well,
more?
well, I go to like the parasympathetic nervous system
Yep.
and what happens, right? And
Yep.
so essentially we go into this like survival mode to some degree. And it's harder when it's generalized anxiety because it's at a lower rate. It's not that like super acute where I'm in fight, flight, or freeze, right?
Mm-hmm.
Or fawn, but we don't rest and digest. We don't like our digestive system doesn't work well when we're
Mm-hmm.
anxious, right?
Yeah.
Like oxygen and blood and like how this kind of like you said headaches and I think like yeah there's less oxygen getting to the brain, there's more oxygen being diverted to our muscles, right, so that we could possibly run away from something that's scary. So
Mm-hmm.
our body automatically kind of kicks into this system that works well to get us out of danger in a short duration, but does not work well over a prolonged kind of chronic experience. So I go back and forth between the chronic effects of anxiety or stress and the
Mm-hmm.
like acute triggering effects and what that feels like. And for different people, they're going to feel those differently and at different times.
Yeah. Yeah. And also racing thoughts. I know racing thoughts is not so much a somatic feeling, but going back to your fight, flight, or freeze,
Mm-hmm.
those racing thoughts, the catastrophizing thoughts, right? That's
Mm-hmm.
usually a key word in therapy, catastrophizing, right? So thinking of the worst case scenario that can possibly happen because of what you're worrying about. And oftentimes I find with catastrophizing, like we can have so many thoughts in a minute in our brain,
Yeah.
and we just spiral down that rabbit hole.
Yeah.
I'm worrying about getting on the bus today to get to school or to get to work. Well, why are we worrying about it? And you can go through like a laundry list, and then ultimately, like within that minute, it's like, well, I may die.
Mm-hmm. Yeah. Even going back to studying for the exam example, right?
Hmm.
If you start thinking, if I fail this exam, I'm never going to get into like university, or I'm going to fail this class. And then if I fail this class, then it's going to, and then by the end of it, you could be like, I'm going to die, or I'm going to be homeless, or I'm going to be
Hmm.
alone. Like
Hmm.
these really kind of ultimate fears that we all have. And if that is being thought about, your body is going to react to that. That is where humans are different than other species, is that when we think about these things, it's like our body is reacting as if they are happening or going to
Yeah.
happen. So I think CBT has been huge for anxiety because it really did highlight how these thoughts can affect, how we feel.
Yeah.
And you're chuckling. I
I'm laughing because I think this is the first time in our many episodes that we are like highlighting CBT.
Yeah, I mean, bang for buck, like a little bit of information about CBT can really help anxiety because,
Hmm.
for a lot of people, when you feel anxiety, you just think that it's caused by the trigger, right?
Hmm.
But to understand that it's our interpretation of that trigger or it's our thoughts about that trigger,
Hmm.
then we start to go, oh, okay. So if I don't catastrophize, if
Yep.
I change it to like, well, it wouldn't be good. It would be, it would be a pain if I failed this exam, but I'd be able
Yep.
to probably, still have a life past
Yeah.
this exam. Yeah.
Well, I think this is one of the points I wanted to bring up earlier. You mentioned the word interpretation, right? It's our interpretation. This is
Hmm.
why also like you will find individuals when they do come across a situation where it is challenging, and maybe to, I don't know, 70% of the population, 80% of the population, it's like, oh yeah, I'm not going to do that. That's crazy. But you find the 20 to 30% who are like, I see this as a challenge and I'm going to face it head on, right? I'm going to go climb that mountain and nobody's going to stop me and I'm going to show everybody that I can do it. It's like what when 70, 80% of the population is like, yeah, I'm not climbing that mountain. Are you crazy? Like, right?
Yeah.
But it's our interpretation of the
Yeah.
situation that's in front of us.
I'll add to that. And I wanted to say this earlier, so I'm glad you said that, and it just brought it right back. There is some research that has shown that, like, when students are studying for exams, if they interpret their anxiety as energy, they perform better, right? So it's our interpretation of the situation, but it's also our interpretation of our physical sensations too, right? If
Hmm.
we interpret the high heart rate as being getting ready for the big game or the big exam or the high stakes thing that we might be doing, we're going to like use that energy. But if we interpret it as anxiety that is going to like ruin our performance, then it possibly is actually going to make us more anxious and likely more going to fail the exam.
Well, this is what they say about high performance athletes, right? There's so many high performance athletes out there for all disciplines, and they've practiced their skill over and over and over again, like so many thousands of times that, they can modify it and do tricks with it and whatever. But it's when you are on that big stage, it's whether or not, again, like from a psychological level, do you feel grounded enough to continue to perform at that level, even though you and everyone else going into that tournament, you can hit that ball just as good as the next person. But it's on a psychological level. Can you stay calm enough or interpret the situation in a way where you're seeing it more as a challenge than a threat?
Yeah. So I do this all the time. I've drawn this out like countless times, like an inverted U curve,
Hmm.
right? So an
Hmm.
upside down U curve.
Yeah.
And on the bottom axis, it's like stress, pressure, right? Anxiety. And on the
Y-axis.
y-axis,
Yeah.
it's performance. So
Yes.
initially we add more pressure, more stress, more anxiety, and we perform better, right? Like you said, we study more for the exam and we do better on the exam. But there's a tipping point. There's a point where adding more stress, more pressure actually decreases our performance. So for athletes, actually right now with the NHL and the hockey playoffs, right? Some players are known to be big game performers, right?
Hmm.
That the more pressure, the louder the crowd, the more at stake, their performance actually gets better. And
Hmm.
other players are known to be underperformers in those big games, right? They're better performing at the kind of regular season games that have less pressure. So I love talking to people about that because then they start to go, okay, maybe putting more pressure on myself to do better on this exam is actually going to make things worse for me, right?
Yeah.
So
Yeah.
understanding that at some point, yeah, the anxiety debilitates us.
And going back to the way it's interpreted, I'm big tennis fan and I love the sport. And I remember listening to Andy Roddick talk about hating to lose. It's on his podcast, actually. He's got a really good podcast. And he was talking about how when he played guys like Roger Federer, they would say like, I just love to win. I just love to win. But he was always the mindset, I hate to lose. And so he never understood the guys who'd be like, I just love to win. I want to go out there. Hey, losing happens, but I love to win. And he sort of, it was interesting. He alluded to the fact that maybe if he had that mindset, he would have won more major championships. But he
Mhm.
came from this mindset, like, I hated to lose. I would get so angry if I lost,
Mhm.
but it wasn't the other way around. So
Yeah.
our interpretation of situations really is so important when it comes to managing our anxiety.
Yeah. Yeah, our thought process. Like you can call it your mindset, right? There's tons of stuff out there about like growth mindset and the way that we think about things and interpret things affects how we act and how we feel. And that, I mean, that's CBT at its core, right? It's really a lot of CBT focuses on the cognitive process that goes along with this. So athletes, high performance CEOs, like there is a lot of focus on this. And again, I think there's tons of material out there. So if you're interested in this, like there is countless examples of resources that look at, changing your mindset or changing your thought process. But sometimes these things are not even like conscious. We don't really know we're
Yeah.
catastrophizing, right?
Yeah.
And then so there's a technique in CBT where they call it like the downward arrow and you
Yes.
and you just basically write like, okay, so what are you worried about? Okay, I'm worried about failing the exam. Okay. And then what would happen if that happened? And then you draw a little downward arrow. Well, then I would get a worse grade on the course. Okay. And then you keep going down. But that's where oftentimes we get to like, and that would be terrible, right? But it's not even conscious. We need to kind of unpack those thoughts because they might have been there for a long time. They might have even started from a traumatic experience that we don't even really remember anymore or we don't think is connected.
Yeah, no, lots to talk about here. What you talked about earlier about performance and like peak performance, it's the Yerkes Dodson curve.
Okay.
Yeah, so like we all have a certain level of stress that we need to perform at our peak, right? Too little or too much, it's going to worsen our performance. Like if we don't care at all and we go to this recital, like we're probably not going to do so well, right? But if we worry too much about it, we might be so debilitated we don't even remember how to play the piano.
We can freeze up, right? And actually, this is where I bring it back to like arousal. I don't even like I'll lump it as like arousal. And so sometimes having a coffee in the morning to arouse our nervous system
Yeah,
allows us to perform better. Right.
yeah,
And so people will just be thinking about their worries or their thoughts and not really being aware of like we talked about, on ASD spectrum and sensory things that can help or hinder us, right? Or
yeah,
arouse us.
yeah,
So the clothes we're wearing, the temperature of the room, there's many factors that affect our nervous system, right?
yeah. So I guess from here, the discussion, we've sort of talked about what anxiety can feel like, this idea of fight, flight, and freeze, and it's the freezing part that, or the avoidance part, the flight and the freeze that really hampers people and for them to seek help because they've gotten to a point now where they've frozen too many times or they've fled too many times and there's this additional sort of worry that's kicking in, like how can I function this way moving forward? I think by the time they usually get to our offices, they know that something has to change. But what does that look like? And am I up for it? Because it's seems so, I guess we've used this word a lot today, debilitating. But it seems so debilitating to have to confront this now.
Well, again, we can have anxiety about addressing our anxiety, right?
Yeah.
Like it
Yeah.
can be scary to go meet with someone to talk about something that you would rather avoid. You would rather hope that it's going to get better on its own, that I don't really need this. I can just suck it up. Like, and like actually this kind of leads to some of the myths about like how we try to help people with their anxiety. Oftentimes we'll tell them to like, don't worry about it, right?
That's like the last thing you want to say.
Yeah.
Don't worry about it.
Well, I laugh because you know what? My dad was like, he's probably the master of this. Like he would often like, and probably my mom was more of the worrier, right? But my dad would always be like, oh, don't worry about it. And he had this like really casual, like no matter what the situation was, like a kid could be like jumping off the roof of the house, and he's like, oh, don't worry about it. And it's like, I think for him, he was able to not worry about it. Like he physically, emotionally didn't have that same arousal level. And so even our own nervous systems, right, are going to be sensitive or less sensitive, right?
Yep.
So we might tell people not to worry about it because we're not worried about it, but that's not where
Mhm.
they're at, right?
Yep.
They're catastrophizing. They're feeling like this terrible thing is going to happen. So I think a lot of times even as therapists, we learn to be able to put ourselves in someone else's position, but with
Yep.
anxiety, that can be really uncomfortable.
Yes. Yes. And so, well, I think you bring up a really good point. Putting ourselves in someone else's position, it's a skill. It's a skill because many of us, like we do think from our own perspective a lot, even with some therapists. And I've heard of some people who have been to therapists before who will, for whatever reason, start bringing in all their own stuff, right? Like, oh, I've been through that situation before, and this is what I did.
Mm-hmm.
And it's like, again, that might not be very helpful because now you're not understanding where the other person is at, right? You're explaining your own situation, but you're not actually actively trying to understand where the other person is, right? And so, like, this ability to be able to say, okay, tell me a little bit more about your anxiety, right? And again, this is not a therapy thing per se. Like, if you're a parent listening to this or a spouse, like you can be curious and ask the other person, tell me a little bit more. Like, what does this anxiety feel like?
Yeah.
Right.
Or even just naming it first, right? Like, oh, this looks really painful, or
Yeah.
you're really struggling right now. And then they're like, yes. And then it's like, okay. So that whole like connect before correct, like before you're sharing
Yeah.
your experience or strategies or psychoeducation, right? And I think we're getting better at that, but still, like you go to your doctor's office and you might get a diagnosis that is really scary. And all of a
Yeah.
sudden, you're not hearing anymore about what the doctor is telling you, right?
Yep.
And
Yep.
so recognizing that we need to connect with people first, and
Yeah.
then we can start to get to some of those cognitive strategies or those self-help books, right?
Yeah. Connecting with someone else, well, connecting with the other person first, naming the anxiety, put it out on the table, right? Because if we don't name it, we're just modeling the same thing that the other person is experiencing is that, oh, we're just going to talk about it in the background. We're not going
Mm.
to bring it out onto the table in front of us, right? So just bringing it right out to the center between two people, like that's really important.
Yeah, going at it head on, I think,
Yeah.
and as counterintuitive as that is, right? So a lot of times I'll say, okay, let's take a breath, right? And we both take a
Yeah.
breath. And I'm modeling kind of like regulating my own nervous system, right?
Yes.
And then it's like, but maybe they're offended by that and they don't want to do that. And then I'll meet them kind of where they're at with that. But I'm kind of tracking, and I know that I'm like helping them regulate their nervous system. That's the way that I
That's right.
look at it.
Yeah.
And then, the head on part, it's like, what's your worst fear? Right? What are you most scared about? And I'm going to go right to the catastrophizing if I can. If it's conscious, let's go there. All right.
Yeah.
Wow. Yeah, that is scary. And then we start breaking it down.
I want to point out though the importance that like we're making this sound easy. Or I think we're sort trying to not trying to. I think that we're making it sound easier than it is. This takes time. Even just being able to like do some relaxation work and breath work, like it doesn't happen in the first session. Sometimes it doesn't happen in the second session. Again, there has to be a sense of safety that, okay, I can trust this person in front of me to guide me through this relaxation, this breath work. Otherwise, again, the whole idea of that is like bringing a sense of relaxation, whether it's progressive muscle relaxation, but it's not going to happen if your client is uncomfortable in the room.
There's parallel things happening, right? There's whether someone feels safe in your presence as well as whether they're able to talk about the fear or the anxiety that's driving their anxiety outside of the office, right? Like,
Yes. Yeah.
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 And so there's different ways. I remember I was doing a practicum placement at the Hope Center or Hope, it's not here anymore, the Hope Institute, I think it was called.
Mm,
Um, and this wasn't in my training, but this was like part of the way that they conducted therapy there. Was it was in an old house that was renovated to be kind of like a bit of an office space, but still had that like home feel to it. And
yeah.
the first thing we would do was ask people if they wanted something to drink, some tea, coffee, water, right? And that act in and of itself already set the tone of like, hey, you're in a safe place. Let's grab a drink, let's grab a tea or a coffee. Like, can I start to care for you before we even walk in the office, right? And I was like, oh man, compared to the clinic where we did a lot of our work, right? Where we're just meeting people in the waiting room and getting them to the office as soon as possible, getting them out of the waiting room, right? So we can start doing our work, right? Like it was like, oh, there is really something to this that I
Yeah.
don't think we've really focused on or put a lot of intent.
So I think we were going to stack this episode, right? We're going to do two.
Yes.
Yeah.
Yes.
Yeah. So I think we've gotten off on one foot here in terms of talking about what anxiety is and the response to anxiety, what the body feels like, the interpretation of our thoughts and a situation. And I think for the next episode, we'll talk a little bit more around, again, practical tips, strategies, management.
Yeah.
Anything else, Dave?
Well, we didn't get to the diagnoses, right? So I think we'll name off some of them and just
Sure.
generally kind of like let people know that, if you are going to a mental health person or a doctor and you get diagnosed with anxiety, there's not a diagnosis that is just anxiety, right? Even though you might get prescribed some anti-anxiety medication, yeah, it's a bit confusing. So I want to demystify a little bit of that for the general
Yeah, for
population.
sure. So we'll leave that for that next episode.
Yeah, this is a bit of
Yeah.
a teaser, and I know we had a bit more structure in terms of how we are going to handle this, but like you said, it's like these things. There's many different paths, and they can kind of just like show up as we're having this conversation. That they all feel really important, and I don't want to wait until later to talk about some of the treatment stuff when we're right there. So,
I think that's the thing with anxiety though. Like there's so much. There is so much. Like it's a blanket for so many different things.
so we get anxious that we're not going to cover all of it.
That's right. That's right. We get worried and anxious that we won't cover it all because
Yeah.
there's so much. Right. So, but we'll try our best.
We will. And, this will work better for some people than for other people. You might want to go to more of a structured and we'll touch on that's the other thing. We'll touch on some of the resources that really do kind of like walk through chapter to chapter a lot of what we're talking about. And that might be a better way of taking in this information. But yeah, welcome to the teaser of anxiety. We'll have part two coming out next week.
It's an introduction. I'll put
Yeah.
it that way.
All right. So try not to worry too much about your worry. And if you can, bear with us and, just care for yourself, care for the people around you in a compassionate way, you'll already be ahead of the curve. And again, this is not prescriptive. This is not individualized therapy, but hopefully you can kind of like maybe think about things a bit differently or experience yourself or others differently. And that will help so that we're not living in that anxious state on a chronic level.
Make a connection, right? I think we've been saying that now probably for the last few episodes, but make a connection, right? Be interested in the person who you're with.
Yeah, and yourself. So,
Yep. Right.
Okay, to be continued. If you like this, hit subscribe, share this with friends and family or other people. Spread the word, and we will keep doing this.
Take good care, everyone.
Take care.